hear these specialties. So we're going to move into A&E, emergency medicine, and we're really grateful to welcome Dr. Anoop Kishore here, who, like I mentioned to you at the beginning, has been on nights. So you're looking very fresh, Anoop, very fresh for having done a night in surgery, which is not an easy thing to do. And we appreciate Anoop. Anoop was actually due to, or one of the people that we were due to get to talk last year. So if you're on last year's IMG Careers Conference, it didn't quite work out with Anoop, but we had him on the books to come for this year. So we're really excited to see what Anoop can tell you about emergency medicine. We do get a lot of questions about emergency medicine. It's a topic that a lot of doctors do think about at some stage of their career, whether it be medical students or whether initial starting. And he's got a great story. He'll tell you his story, I'm sure, in more detail. Currently working as an emergency medicine registrar. So the night would have been very busy last night, no doubt. Moved to the UK in 2017. He's done some great things, which he'll tell you about in a short while. But Anoop, thank you so much for coming on board. We're going to hand over to you.
Yeah.
And look forward to hearing.
Thank you. Good morning, guys. Aman, can I share my screen from here?
Yeah, I'll just switch you in a second.
Perfect. Good morning, everyone. Nice to see you all. Okay, I'm Anoop. I'm one of the emergency medicine registrars in the south of England. Let me begin by sharing my journey to the UK. I finished my undergraduation in Tamil Nadu, southern part of India. During my internship, I developed my passion and interest towards emergency medicine, and I went on to pursue my post-graduation in emergency medicine. And I completed my membership exams as MR Chem in 2016 in one of the top private hospitals in South India. I then worked as a registrar for almost a year before I relocated to the UK. I was successful in my first interview and started as a senior clinical fellow in the Department of Emergency Medicine in one of the university hospitals in the south of England. During that year, I worked towards obtaining a successful training number in emergency medicine, and I was successful in both my ST1 and ST3 interviews, and I was also the topper in both of these interviews. I chose to do ST1 emergency medicine, and I opted for the south of England, and I'm currently an emergency medicine registrar in the south of England. I'm also the representative for the ACCS Emergency Medicine Group. I've also been working along with my colleagues to establish an IMG peer support group. As some of you might know, I run a lot of live Facebook sessions regarding emergency medicine, how to obtain a successful training number, how to get your portfolio before your training, etc., along with my ED colleagues. I'm also working on a survey to analyze the induction programs across various hospitals in the United Kingdom and how are the IMGs adapting to it. I would appreciate if you could all complete the survey, which I will post it at the end of my talk. It is completely anonymous, so you don't need to worry about your identity. Well, why emergency medicine? In the recent era where the entire medical world is moving towards subspecialization or super specialization, we, the emergency physicians, utilize all our skills and practice all our skills and apply our knowledge acquired throughout our medical training. We see patients with various acuities and cover various specialties. To be fair, we can say that we are one of the last true generalists that exist now. We are also the specialty to see undifferentiated patients, because we are the friend door to every hospital. We see the patient with just their chief complaint, work towards the provisional diagnosis, and then refer them to the concerned specialties. Communication. You interact with various specialties in the hospital, you interact with the pre-hospital team and across different other allied healthcare professionals. It's a good way to improve your communication skills in emergency medicine. There is a lot of opportunities for research in emergency medicine, and if you could see, most of the researches with COVID are now conducted in ED and ITUs. Work-life balance. Yes, we work odd hours, I agree. However, if you are proactive and if you plan your rota well, then I think you would definitely have a good work-life balance. There are lots of opportunities to improve your leadership and management skills in emergency medicine. because you have an opportunity to lead a team during your trauma or during a cardiac arrest, etc. Procedures, as you all know, we do lots of procedures in the emergency department, ranging from manipulation of joints, sedation, intubation, cardioversion, chest drain insertion, etc. Pertaining to the IMGs, why emergency medicine as your first job? First thing, job opportunities. You've got lots of vacancies in emergency medicine, and as you are new to the NHS, I think working in ED will help you know the NHS structure and get yourself oriented to it. Remember, you are never alone in ED. You are always supervised by a senior doctor and you work as a team. So that's a good opportunity for the IMGs to get accustomed to the system, their trust protocols, and also to find your passion about your interest about to various specialities, and then you can also work towards obtaining a successful training number in that particular specialities. You interact with lots of people, as I mentioned earlier, and again, it's a great opportunity to improve your communication skills, and your referral process to make it smoother, like using different formats like your SBAR format for your referral processes and fine tune them. The emergency medicine is a 6-year training program in the United Kingdom. So it's split into ACCS, which is your acute common care specialties, which is from ST1 to ST3. So basically your ST3 is your intermediate training. And then you have your higher specialty training, which is from ST4 to ST6. In the first 2 years of your ACCS, which is your acute common care STEM, you do 6 months each of emergency medicine, acute medicine, intensive care, and anesthesia. During those 2 years, you clear 2 exams called the FRChem Primary and FRChem Intermediate, which are all single best answer questions pattern. During an ST3, you get exposure to your pediatric emergency medicine, and you do some minor injuries like your musculoskeletal also. And then you clear your MRChem exams, at the end of which you'll be finished with your ACCS on your intermediate training. Then you go on to an ST4 to ST6, which is a higher specialty training, where you have more opportunities to boost your leadership skills, your management skills. And then you have 2 exams called the FRChem Final, which is your SBA single best answer, and then your OSCE. Your emergency medicine training comes in 2 training pathways. One is the coupled, and the other one is an uncoupled one. If you opt for a coupled training program, you start from ST1 and then you end in ST6. In an uncoupled training program, you start from ST1 to ST3. At the end of ST3, you reapply for your training to emergency medicine training at ST4, and then you go through your interview process, and then you continue your higher specialty training. Now there is a move towards more move towards the coupled training in emergency medicine, because especially for the IMGs, if you opt for a coupled program, it makes your visa process very easier. You don't need to reapply for your training process again. And I would be telling you about the completion ratios soon, and so you will understand there is more push towards the coupled training nowadays. The emergency medicine training, as I said, you can enter at 3 levels. One is the ACCS pathway, where you first apply for your ACCS specialties. You take your MSRA exams, the multi-specialty recruitment assessment exam. And then once you're successful through it, you go through the interview process, and once you're successful, you enter at ACCS. So if you choose for a coupled, you finish your 6 years of emergency medicine training, and at the end of which you will be given a CCT in emergency medicine. The other pathway is the DREAM pathway, which is the defined route of entry into emergency medicine, where you basically start from your ST3 level. If you have prior emergency medicine exposure, okay, and you've already worked as a middle grade for a few years, then you can apply through DREAM program, provided you've got all your ACCS competencies signed off by a UK consultant. Or people from other specialities, like for example, if you are in a core surgical training program and you have opted to switch your specialities, then you can directly apply through your DREAM pathway. If you're in approved UK core surgical training program and then you've opted to switch specialities and you're applying to DREAM program, at the end of your 5 years, you'll be getting a CCT in emergency medicine. If you are doing complete 5 years with your prior exposure to emergency medicine or your prior experience as a registered in emergency medicine, again, you'll be getting a CCT. If you do less than 5 years in your DREAM program, then you will be given a CSER CP in ED. The next one is your HST, which is from ST4 to ST6. Again, if you've got previous experiences in emergency medicine and you've cleared all your exams, then you can apply straight at ST4 level. Or if you apply for an uncoupled training, again, you can apply for an ST4 level. If you have not done your previous ACCS program and you're applying directly to your ST4 interview and you're successful to it, at the end of your 3 years, that's ST4, ST5, and ST6, you'll be given a CSER CP and not a CCT in emergency medicine with the GMC. The timeline, this is an approximate timeline and it can change actually. So your ACCS emergency medicine, the round 1, the call for the adverts will go up in November, and round 2, based on the vacancies, it'll be by March or April. Remember, your academic year in ED starts in August of that academic year. So if it's November 2021 now, the application is for August 2022. Okay. For the DREAM, your round 1 will be in March, and depending upon the vacancies, you may or may not have the round 2 also. So as I said, EM is a 6-year training program. You can do subspecialization or dual training when you're doing an emergency medicine training program. The first one is the pre-hospital emergency medicine, which is the FEM, where again you apply during your ST4 training year. It is 1 year if it's done separately, or if it's coupled with EM, it can be 2-year program also. You need to give 2 exams, which is your DIMC, Diploma in Immediate Medical Care, and then FIMC. At the end of 6 or 7 years, you'll be subspecializing in pre-hospital emergency medicine along with your parent specialty of emergency medicine. The second subspecialization is the pediatric emergency medicine, which is a 1-year training program. And again, you can apply locally, and they'll conduct the interview process and they'll give you a training number in pediatric emergency medicine. At the end of 7 years, you'll be specializing in pediatric emergency medicine subspecialty. Then the next dual training program is your intensive care medicine program, where it might range from 2 to 3 years, depending upon your previous competencies. At the end of 8.5 to 9 years, you will be dual accredited in emergency medicine and intensive care, and you need to clear your FICM exams, which is of, again, 2 steps. So this is the recent completion ratios, which I've highlighted here. I just want you to just note down the number of applications and the number of posts. So for the ST1 emergency medicine, you could see a steep rise in the competition ratio. And for ST3 emergency medicine, because lots of posts are being moved towards the ST1, I think you have got less number of seats, and at the same time, the competition has been increasing steadily. There is a lot of competition, guys. Yes. So here are a few tips from me to be how to obtain a successful training number in the emergency medicine. So first, your initial few months, I would say 3 to 6 months, get oriented to NHS, okay? Meet with your educational supervisor, and then plan your personal development plan. Look and read through your CREST processes, and also make sure that you go through your person specification for ACCS emergency medicine and work towards it. You can get involved in audit or QUIP to boost your portfolio. Teaching is another important aspect. You can teach medical students, nursing students. Make sure that you get appropriate feedback, and then you do assessments with your supervisor if possible. Work towards your portfolio. You can obtain an emergency medicine portfolio, like a Kaizen portfolio, which we use for trainees, even as a non-trainee. Towards the nearer the date for your interviews, try to do some mock interviews with your consultants, which will help you getting a successful training number. Further reading, these are the few links which I'll be posting it in the chat box soon. So the first one is a link to the Emergency Medicine, College of Emergency Medicine. The next one is about the person specifications for HCCS and ST3 Emergency Medicine. The next one is the timeline of approximately and the vacancy list. And the third thing is about your CREST form. Thank you. I would encourage all of you to join me in the world of emergency medicine. I would also like to acknowledge all the meme creators for helping me with the animations used throughout my presentation. I've posted my email address and my Facebook ID. You can direct message or private message me if you want any further guidance with regards to getting a successful training number in emergency medicine. I'll also post the survey link for the IMG survey. Take care, stay safe, and I think I'm happy to take some questions if there are any.
Hi, Anoop. Thank you for that insightful talk. Appreciate it. So yeah, lots of questions have come through. First question that's come through is any advice preparing for the MRCM exam?
Yeah, I think I think they meant to ask about the FRChem primary and intermediate, which is your single best answers. Okay, go through your Oxford Handbook of Emergency Medicine. There are lots of mock question banks available. So if you get your basics right and do some mock exams, then you should be successful. For your MRChem OSCEs, I think you need to do some practice sessions. Again, there are lots of courses, including the Bromley courses, and sometimes your hospital might run local courses, and if you attend all of them, you should be successful. It's all about your shop floor experience. If you are able to work 100% in your shop floor, and I think that's the same that gets converted into an exam question, so it should be okay. So give your 100% on your shop floor, and you should be successful in your MRChem exams.
Oh, thank you.
Yeah, thank you, Anoop. Really good talk. Really to the point. Went through some really important things that people often ask about, and I think it's very clear the way you laid it out. So thank you so much for that. I had a question, someone, can you talk a bit more about working hours in EM, if possible?
Again, as I said, we work odd hours. It depends on a specific trust or hospital. Some of the hospitals might just have 3 shifts. That's morning, late, and nights. That is 8. Some of them might be 8 hours or 10-hour shifts or even 12-hour shifts. So sometimes they may work from 8 to 5 or half 5. And some hospitals may write from 2 in the afternoon to midnight, and most of them they do nights, which is from night 10 o'clock to morning 8 o'clock or morning 10 o'clock. Some of the hospitals tend to do this odd shifts, especially the busier hospitals and the major trauma centers, where you do a shift called the twilight shift, where you start at around 4 o'clock or 5 o'clock in the evening and finish at 2 or half 1 or even 3 in the early morning. So it depends on the hospital that you work in. But as I said, if you are proactive and if you plan your rota well, then you should have a good work-life balance. And I think the rota is always a little bit difficult for all the junior doctors, be it whatever specialty you work in. So I think it's just those training years that you need to accommodate and be more proactive in planning your rota.
Yeah. It's one of the commonest things that's talked about, isn't it? Emergency medicine and hours and rotas and things. But a lot of it, as you said, is planning and
I said, I think once you become a consultant, because you work a lot of antisocial hours, I think you get most of your chunk of your PAs by just doing a few shifts rather than working the social hours kind of thing. So if you do 1 or 2 unsocial shifts, you're done for the entire week. When you become a consultant, that takes lots of your PAs off.
Mm-hmm. Yeah, that's really helpful. Kuja? Oh, I think your mic's off, Kuja. So I'll ask a question. Is there a specific reason why EM competition ratios doubled this year?
Yeah, I think it's because lots of people are moving towards EM specialty, and they've started, realizing the importance of EM. It's a quick run-through program, and I think some of them feel that they're, as I mentioned about the generalist kind of thing applies, and some of them are more interested of seeing a variety of cases rather than the same work-life pattern. I think they would like to see a variety in the daily cases, and I think that's the reason the completion rates have gone a bit higher when compared to the previous years in emergency medicine, especially with the ACCS interviews. If you could see, this year it was around 1,467, which is the highest across TCS.
Mm. Yeah, no, competition is certainly going up for a number of specialties. It's going up actually, which is good to see in some ways. Pooja?
Somebody's asking, how do they gain an extra edge when applying for emergency medicine?
Yeah, as I mentioned, the nuggets I gave you was, go through the person specifications. Okay, when you're applying for ACCS emergency medicine, go through the person specifications, speak to your supervisor, make a personal development plan with them as early as possible so that you can get your press form signed at the same time. Boost up your portfolio by doing some audits, getting yourself involved in the quality improvement projects, do some teaching for the juniors, do some workplace-based assessments with the senior colleagues, do some mock interviews, which will get you used to the interview processes. And I think with all these, I think you should be successful in emergency medicine training.
Yeah, that's really helpful. There's actually quite a few questions come in with some specifics, Anoop. So would you mind if we just share those with you to your chat, so that, because I think they're more individualized rather than generic.
Yeah.
And I don't want to miss anyone's questions out. So if you wouldn't mind, can we just share a few to you?
Yeah,
so
sure.
you can then just respond to them directly, because I think
or they can email me on the email address given, or they can also DM or private message me through my Facebook, and
or we can share a couple here directly. It'll come into your box in the tab.
I'm happy to answer.
Really helpful.
Yeah,
brilliant. But I think that was super. Like I said, short to the point. Really covered the core things. Get some really good tips there as to how to kind of get ahead of that ratio, and how to be in the top selection that get in, because it's not easy to get into EM, and you have to have a bit of guidance from people who've done it before, like yourself, which gives these edges. So that, yeah, really helpful. Pooja, any final words before we jump into a break?
No, we really appreciate your time, Anoop. It's not easy post nights to come on board and do a presentation, so we won't take up too much of your time further, so that you're able to rest up for your next night shift this morning. So thank you for sharing your contact details and an amazing talk. So please do get in touch with Dr. Anoop. He does lots of talks about getting into emergency medicine and is really giving back to the IMG community and sharing his insights. So thank you, Anoop. Really appreciate your time this morning. And as I said, we'll forward some of these questions on to you. And if people still want to ask you more, then please get in touch. But just a bit more information, and I'll let you carry on with regarding this session, but Anoop, you might want to stick around to see the feedback given, but we'll also share some feedback with you separately. Thank you.
Thank you, Pooja. Thank you, Aman, for giving me this opportunity. It's really good to see lots of IMGs here, and I'm happy to guide them towards EM.
Thanks, Anoop. I think what you're doing is fantastic, and all the social media stuff that you do, I think is really helpful as well. No doubt some of these guys will already be in touch with you and asking you questions. But if you do have any specific questions for Anoop, please do jot them in now, because Anoop can't stay around for too much longer, but he will try and answer those ones that we send across to him. Guys, how was this session? We've had 2 talks.